I'm Ed Kelley, editor of the Oklahoman. Oklahomans without health insurance continue to cost the ones with it. That's always been the case, but it's not easing off. My colleague Valerie Brown cites a recent report that shows insured Oklahomans pay about $710 more per year to cover the cost shift from those who can't pay. At Integris Health, officials there saw some $250 million in bad debt and charity care in the recently completed fiscal year. That's a whopping 30% more than just 2 years ago. Integris and other nonprofit hospitals have to take a certain amount of charity care to maintain their tax status. But these hospitals have to remain solvent if they're going to keep the doors open. Even some hospitals are noticing the insured are having more trouble paying their share of the hospital bill. At the same time, more Oklahomans are foregoing insurance altogether, particularly young adults. No doubt many of them feel they can afford not to carry insurance because they're in relatively good health. But what happens when they get in a serious car wreck and rack up $100,000 in hospital and related bills? Who pays for that? That's just one of the factors driving up health costs. Of course, Oklahomans without health insurance mirror those who don't carry car insurance. 1 out of every 4 drivers in our state drive uninsured. A new state law will usher in an electronic verification system to give law enforcement officers the ability to confront motorists about their lack of insurance. Over time, this should cut down somewhat on the uninsured rate. But the issue of health insurance is much more complex and, unfortunately, without easy answers, particularly in a sagging economy.